One of the most common conditions people complain about during the January and December period is heartburn and indigestion, both related conditions that have to do with the bad diet behavior that follows after overindulging. But luckily for most people, the symptoms can be treated quickly and effectively. Just ask your local pharmacist, like Fransa from PicknPay Pharmacy. Welcome to Doctor's Orders.
Hi.
Just a recap for our viewers, let's focus on indigestion. Indigestion is often a sign of an underlying problem such as gastroesophageal reflux disease, ulcers or gallbladder disease, rather than a condition on its own. It's also called dyspepsia. Indigestion is a term used to describe a feeling of fullness or discomfort during or after a meal. It can be accompanied by burning or pain in the upper stomach. What do people generally complain about? What symptoms do they complain about?
They would usually come in and say they've got a burning sensation in their chest or bottom part of the throat. Not usually pain, more this burny, acidic feeling and bloatedness.
And what do you advise them, first of all, from a lifestyle perspective?
Well, we would find out, did you have something spicy food to eat last night, or did you have a lot of fatty food? And we'll just find out why would they be reacting that way. And from their answers, we would then probably decide to give them an antacid that would help for the burn and ease the burn. Also, some of your medications will help when you take that. It actually forms a layer on the content of the stomach, and it prevents that acidic fluid from refluxing into the esophagus.
And what other medication is out there to assist?
Look, you get your stronger medications where you get your PPIs, as we call it, and your H2 receptor antagonists. And those tablets are very effective. They actually help reduce the amount of acid that is produced in the stomach. But you can only buy that for a 7-day period. Because the uncomfortable feeling, the heartburn, the pain is because of an underlying condition. So you don't want them to use those tablets that reduces the acid in the stomach for long periods of time and not go to a doctor and see what is really wrong. So if they've used it for 7 days and it's all cleared up and everything's fine, then you know there's nothing major that's wrong. But after 7 days, if it still reappears, they need to go and see a doctor.
Then you have to worry about Helicobacter pylori infection, which can actually cause a lot of ulcers. And you have to have that
antibiotics, which your doctor would then prescribe.
And are there any other final tips for approach to indigestion?
It's important to just watch out. We all tend to eat a lot more than we should because the food is so nice, and the pudding and all the cakes. So you're going to find that you're eating more than usual. Rather try and eat little bits at a time, smaller meals, and try and cut back on the fatty and the rich food, and also alcohol. If you drink a lot of alcohol, you're going to end up with the same problem. Thank you so much, Frans, for joining us on Doctor's Orders and for sharing your experience and giving us tips on how to approach indigestion. It's a pleasure.
By supporting the Hoedspruit Endangered Species Center, that's where we found goodness. Pick n Pay, always there for you.